Hey guys, Dr. Ashley Friedman here. I am a physical therapist who specializes in the pelvic floor. In my last video, I went over what the pelvic floor is and why it's important. So today, what I wanted to do is do a quick video on essentially different diagnoses that I see in clinic that can benefit from pelvic floor physical therapy. So a lot of questions I get is, do I need pelvic floor physical therapy, or how do I know I need physical therapy? I think by providing you guys a list and breaking it down into bladder, bowels, pain, pregnancy, postpartum, and then like procedures post-operatively, preoperatively, different diagnoses and things that we treat might be really beneficial. Moving forward, I want to break down each diagnosis that I'm about to go over and that I see in clinic and explain what it is, why it might be happening, what could be the cause, what are things that you can start doing, and maybe what pelvic floor physical therapy treatment will look like for that issue. So let's go ahead and let's get started with the bladder. So the first thing is overactive bladder. This is urgency, frequency, any form of leakage with urgency. And then stress urinary incontinence, which is coughing, laughing, sneezing, jumping, running, and you're having leakage. Interstitial cystitis, which is painful bladder syndrome, so if you've ever been diagnosed with this, also referred to as IC. Real enuresis, which is bedwetting. Getting up multiple times, more than 2 times a night to use the bathroom and you're not pregnant. Incomplete emptying of the bladder, or a sensation that your bladder is still full after you go to the bathroom. Having difficulties initiating your urine stream, or feeling like your stream gets interrupted when you're urinating. Those are really the big things that I see in regards to the bladder. Moving on to the bowels, we have chronic constipation or inability to evacuate or empty the bowels, difficulty with pushing and straining to empty the bowels, feeling a sensation of fecal urgency, meaning you have this strong urge to go to the bathroom and it's pretty violent and you're having trouble getting to the bathroom. Leakage of stool, so whether that's with urgency, that's with flatulence, which is passing gas, or with jumping, coughing, running, any leakage of stool. And then also not being able to sense when your bowels are full, so not getting the proper sensation that you need to go to the bathroom. Are the things that I see in regards to the bowels. So for pain, this is a wide spectrum of things, so there are more to this list as we get more specific. Starting with pain with intercourse. Are you having pain with intercourse? Are you having pain with orgasm? Are you having pain with arousal? Meaning you're not just thinking of intercourse, you feel pain in the pelvis, in the vagina, in the rectum. Are you having suprapubic pain, so pain in the lower abdomen? Are you having lower back and hip pain that has not responded to general ortho physical therapy or other treatment? Are you having SI joint pain, so where your sacrum sits, pain right in that region? Or are you having tailbone pain? Are you having pelvic pain, pelvic pressure, pelvic heaviness throughout your day, after delivering a baby, after a pelvic surgery? Are you having pain with urination and spasms and discomfort with voiding? Are you having any type of rectal pain or spasming? Are you having pain with defecating? Are you having pubic symphysis pain, so right at that pubic bone? Have you ever been told you had something called vulvodynia? Are you having pain post-radiation? So if you've had rectal cancer, cervical cancer, and you've had radiation to the tissue, are you having a lot of pain post-radiation? Moving into like pregnancy and postpartum. So are you having discomfort and pain in the back, the hips, the vagina during pregnancy? We can also treat women who want to go over birthing techniques and childbirth, positioning for birth. Are you struggling with instability, feeling like your pelvis is unstable, or like it's going to give, or your SI joint's going to give out after you deliver your baby? Are you having pain and pressure postpartum? I did say that before. Are you having something called diastasis recti. So when you sit up, it's really hard, or you feel like you get this bulge in your abdomen when you're trying to sit up. You feel like your core is so weak. Post 3rd and 4th degree lacerations after birth. So when you delivered, did you have a really bad tear? I will also do pelvic floor physical therapy like prehab. So before you're having a pelvic floor surgery, a hysterectomy, or prolapse repair, so a cystocele, a rectocele, and pterocele. And then also doing post surgery of those things, along with if you've had a colostomy, if you've had a hernia surgery, vaginoplasty, a labioplasty, any type of pelvic floor surgery. I would recommend seeing a pelvic floor physical therapist post-operatively once you're cleared, and we can get into those things in more detail. And then just for some other things that I didn't mention that kind of fit in there, just a random, we'll call this the random category, is you just feel a general weakness, like you're unable to do a Kegel and squeeze down below. And then we also treat something called PGAD, which is persistent genital arousal disorder, meaning you are having orgasms randomly throughout the day with no warning. Those are a list of things that pelvic floor physical therapists can help you with and can treat, and what I specifically see in clinic all the time. So I hope that helped just give you a good list of information, a good resource. So if you're trying to figure out, I wonder if pelvic floor physical therapy could help me or my friend or my mom, you'll have it right here. And comment below on what you want to see next. All right. Bye guys. Have a good one.